This is supposed to be a view from the outside, but I'm not an outsider. I've grown up here, and I've, worked with India for the last 17 years. So what I'll do is I'll very quickly, initial slides, I'll go through them quickly because they're really setting up the context. Then I'll talk about a case study of partnership between Stanford Biodesign, Stanford University, AIMS, and IT Delhi. And then I'll linger on in my last slide, which is really recommendations. So this slide really talks about the history of innovation in India. My talk is really about how do we teach innovation in higher education institutions. And it's important to know what the state of innovation in India used to be. India was a very innovative country. And I'll come back to why it used to be an innovative country. And then when you look at the list of innovations in the pre-Islamic era in British Raj, the number drops dramatically because we were torn by strife and resources were not quite there, and there was no principle or philosophy of curiosity. And then what you see in the independent India, there's been some work, but a lot of that has been done by diaspora. Within the country, the innovations have been limited, mainly because we're really trying to educate our population, bring them at par to Western countries, and that's been a challenge for the institutions, including the one that I was educated in. Next slide. And this is really a summary of the law. What is the lost centuries, the cause of lost centuries of innovation for Bharat? There a number of reasons. First and foremost, there was a dismantling of experiential learning. Gurukuls used to be very experiential. You learned by experiencing the world around you. So it provided that context, local context. The tradition of innovation, tradition of knowledge transfer, it was interrupted. You had stasis in science because of the conflicts that were going on. You also had these imposed, this part on is British Raj. You had imposed colonial solutions, such as jute was replaced by synthetic fiber and on and on. That limited the potential for innovation. And last one is that there was a loss of local innovation to market value chain, and I'm going to come back to that as well. And the very last thing is we were forced, because of resource constraints, to do jugaad rather than structured, scaled innovation, which we used to do before. Next slide. Independent India has been really India. It's not been Bharat, okay? So that phrase is used in a particular way. So there's the good and the bad and the ugly. And I think that first and foremost, there's been tremendous amount of training through IITs, advanced science and technology. So that's a good. A reservoir of respect for education, that is very good. No matter which part of India you go to, even our maids and menial workers have tremendous value for education. So that's good. There is a problem-solving mindset still, but it's very tactical, the jugaad mindset that we talk about, which does not lead to scaled innovation. And the bad and the ugly part is that we have very much of a task orientation. This is what British education taught us. We were a cog in the wheel. Macaulay wanted us to be a cog in the wheel, and that led us to become very task oriented, which you deal with a student that's coming out of our current institutions, really good in tasks, but not really good in problem solving. And then it's very top down, not ground up, because we have lost that connection with the ground. And loss of Gurukuls was part of that. And the last one is colonial view of indigenous innovation. How many of you would prefer to use or buy an Indian-derived or Indian-made product compared to one that's coming from outside? Most of us would not, mainly because we associate quality with what's coming out from outside. And that view has to change. The colonial view has to change. Next slide. Today is a very interesting moment. There's substantial societal need. There's food, education, health. No matter which area we look at, there are huge challenges, 1.4 billion people. That's a problem and an opportunity. We have aspirational young Bharat, which is willing to venture out. And venture out, as the term is used very, very intentionally. There's a steady arc of economic growth because of the advective effect of macroeconomy. So we will continue to grow economically. And there is aligned geopolitical environment and policy making. Our current government seems to be very focused on India becoming a dominant economy, a leader, and geopolitics is supporting it. Next slide. So here's the 5-pillar framework for innovation in Bharat. This is really back to future. I'm back to future because what we used to have in the past was very futuristic. We need to have distributed, empowered innovation community. We need to have deep focus on local unmet needs. I think a lot of our solutions are still focused on the part of the society that is very broad and that is very high level and very elite. We need solutions from the ground up. We need a friction-free innovation to market framework, and policy will play a role in it. We need acceleration of an enabling policy regime and a public goods infrastructure similar to what has happened with UPI, which has been a game changer, and Ayushman Bharat Digital Mission and the government e-marketplace. And the last one is that we need global world-class partnership on emerging technologies that are critical for the future, AI, quantum, quantum physics, and things of that sort. Next slide. This is where I come to higher ed and innovation. I think we need to change our lens, and this is, all of our institutions, including the institution I'm on the board of. We need it to be not about jobs and tasks, but we need to be about problem solving. We also need to have a functioning innovation ecosystem, mentors, funding, ecosystem, partners, and access to markets. We have faculty that have never been trained on innovation. You were talking about faculty members who are teachers, right? Who have that mindset of teaching. So we also need teachers who have a mindset of teaching innovation or problem solving. So that's really appropriate comment there. And we also need case studies of success that can be scaled. So because exemplars of success create the way. So the reason we see so much of IT entrepreneurship economy in India right now, because there were some early innovators that succeeded, and that created exemplars that everybody else wants to follow. We need that in every space, including in agricultural innovation. Next slide. Yeah. So I'm going to just do very quickly the case study for Stanford Biodesign in India. Stanford Biodesign is a health technology innovation program at Stanford. It uses design thinking to identify unmet clinical needs and then solve those problems, and then scale them. We started this partnership 17 years back with AIMS and IIT Delhi, and for the first 8 years, we only taught this innovation framework. And then as we were teaching this innovation framework, we realized that most of these innovators were not going to succeed because their solutions were not going to get to the patients. India did not have an ecosystem supporting these innovators. They didn't have manufacturers, they didn't have pilot facilities, they didn't have clinical trials facilities. Those things didn't exist the way they exist in the US, for example. So we spent phase 2 of our work in India from 2015 to 2019 on bringing these founders together, called it Founders Forum. And then we realized that even though many of these innovators are going to succeed in the private sector, most of India's healthcare is provided in public health system, and public health is a state subject. So we need to work with the state government and the federal government to create the right kind of policy environment to procure these technologies and implement that in the public health system. That's the only way these companies are going to become from small startup to mid-sized companies to large companies and create this vibrant innovation to market ecosystem. So that's what we have tried to do. This is the framework. It has 3 steps in our framework: identify unmet needs on the ground, and then invent a solution for it, and then implement it. This is what we taught. Next slide. And the outcome of that has been there are now in India 20 plus medtech innovation programs. 11 of them are formal programs funded by DBT and ICMR. There are 1,000 health technology innovators in India. This is the 2nd or 3rd largest innovation ecosystem for health technologies in the world. Just in 17 years, India has gotten there. So India can do it. There have been more than $1 billion invested by the government. Government gets a lot of credit, especially over the last decade, and investors to support these companies. These companies would not have survived without that because there was not an existing investor ecosystem at that time. Next slide. Next 4 slides are just examples of technologies. I'm not going to go through in details because I want to save time for Q&A. This is a neonatal hearing screening device. It is used in rural settings where they don't have sound boxes, where insulated sound boxes don't exist. This uses the hardware and AI solution to filter out the noise. You can actually screen newborns in rural settings for hearing loss or impaired hearing, and that could save decades of learning disability in these children and make sure that they become part of the mainstream. So really remarkable innovation. It's the first innovation of its kind in the world in 50 years. This has already saved tens of thousands of babies, has been used with hundreds of thousands of babies around the world, 12 plus countries. And it was developed by Dr. Avijit Bansal, a foot pedal operated neonatal resuscitator, which can allow somebody with lower level of skill, or even a nurse practitioner, to save a baby, a newborn that is facing asphyxia. Next slide. This is a remarkable solution for ophthalmological disorders. It's a screening solution that can be set up in rural settings so that you can actually screen patients for eye diseases. And the data comes to the central facility. The patients can be moved from those primary centers to secondary and tertiary care centers as the conditions are become apparent and more advanced. And this is the last slide. This is for cardiovascular disease screening. Both the previous innovation, this innovation has already been served, have already served 15 million Indian patients each. This technology has already saved tens of thousands of people who had heart attack in rural areas. So, India can do it. It has the potential. It has the intellectual capacity. We just need the right kind of partnership. So these are my recommendations. Number one, introduce training innovation, training of innovation in frameworks in core curriculum at all levels. I would argue starting with middle school. Start with that. And by the time they get to higher education, they should already have decent understanding of what the innovation frameworks are, so they can become problem solvers. Recruit students not for grades. I think my fellow panelists talked about it, but for capacity to problem solve. They should not be grade earners. They should be problem solvers. We should invest in training faculty, going back to faculty, and recruiting from global centers of excellence. But we should incentivize them heavily on solutions for Bharat's unique needs. They should not be working on problems that are more relevant to the global setting, although that's important. I think they should start with solving India's problems first. And the last part is we should actually, in higher education, learn to partner extensively with industry, government, and civic society. If we don't do that, we will work in silos, and our solutions are not going to go anywhere. Thank you.